But joining us now to discuss all of this is Dr. Daniel Kelly. He's from New York University's Robert Tisch Institute for Global Sport. Dr. Kelly, thanks so much for joining us. This decision of how to safely play sports in a pandemic, it's obviously a tricky one. What's the Super Bowl doing, and can others like the Olympics learn from what's happening?
The best part about the Super Bowl response is that the NFL has put together 25,000 kits, which are going to have KN95 masks plus hand sanitizer for each of the attendees for the event tonight. This is going to be a very paramount event and will be the most watched event this entire year in the United States. And so this will be a benchmark for how to fully understand the implications of COVID-19 and to do proper prevention, which is going to be through the kits.
So you think it's important that the NFL is sending a message that America is seeing on Sunday?
Yeah, the most important message is that COVID-19 is still prevalent. It hasn't gone away, and that we still have to be mindful, and safety is the utmost concern. And so by having the kits available to all the attendees and also scaling back their virtual events to make sure that all the events were virtual this weekend. They have a flagship event called the Taste of the NFL, which is a food and wine event that unfortunately this year had to be virtual. And so the NFL has gone through a ton of sacrifices to ensure that the game today will be as safe as possible.
At the end of the day, football in America is a business. Have there been instances in which the players, the employees have said, this isn't safe? Is there space for something like that to happen?
The NFL has set a pretty good example. You know, they tested not only the players, the staff, and all the support staff. They've gone through about 15,000 tests this year, with over a million different results. And so they've been able to showcase that they can properly put the funding towards the proper testing protocols. And out of the, 1 million tests, 700 people actually tested positive for coronavirus, and they were able to use their contact tracing methods to be able to ensure that safety protocols were followed.
Health officials have been encouraging people not to gather for the games. Do you think sports fans in America are heeding that call?
I think for the most part they are. We're still hearing about these private events that are occurring for the Super Bowl, but to know that the official sanctioned events in each of the cities have been canceled and they are promoting virtual events seems to be that the message is being put ahead that, fun should come second to public health.
For our international viewers, why do you think it was so important for the Super Bowl to happen this year?
I think it's important to show that there's still a continuity of business, of life, and in spite of the restrictions of COVID-19, the Super Bowl does showcase that at the highest level, you can have sports lead the economy back to fruition. And so having the Super Bowl event in this current climate of COVID-19 under the protocols of safety and public health is going to set a prime example for the rest of the world.
I want to talk about the racial element of sports in America. Critics point out that it's largely wealthy, largely white owners of teams with largely black players. 2/3 of NFL players are African American, and it's them that are putting their lives in the midst of a pandemic at risk so that others can make a buck. Do you think there's merit in that criticism?
I think that the merit comes down to the opportunities, and the fact of the matter is that the NFL players are leading the cases when it comes to vaccinations. And so they are, yes, putting their lives on the line each Sunday they go out to play. But the bottom line is they are serving as role models for underprivileged and underprivileged communities in the United States which don't have access to COVID vaccinations. And so by them showing the proper cause and the proper effect of COVID vaccinations and following the proper COVID systems, we're going to see that the role model is going to increase the number of cases of vaccinations for the Black and brown communities in America.
I appreciate that. Dr. Daniel Kelly from NYU, thank you for joining us.